Good afternoon. I'm Brooks Keel. I'm the president of Augusta University, and I greatly appreciate you taking the time to spend a little time with me this afternoon on this town hall as we cover a couple of issues that have come up that I think many of you have questions about. And hopefully, you will find this town hall informative. And if you have any suggestions or ideas as to how we can improve how we communicate with you, please let us know. We're doing everything we can to keep you up to speed on what's going on and to provide you with the latest and greatest information. So thanks again for being with us here today. This is the legislative season. If you've been watching the news at all, you probably already know that in Georgia, our General Assembly convenes the second week in January, and for 40 days they debate on a number of issues that have impact on us here at Augusta University, including the budget. And I want to spend a little bit of time talking to you about the governor's recommendation budget. It is very good news for us at Augusta University and indeed the entire higher education system in Georgia. And I know you have some questions about that. So I thought it'd be helpful to start off today is to give you a little insight into what happens under the Gold Dome and to give you with some information regarding what the governor's recent budget recommendations are. Now, this is a very complicated slide, but hopefully it will provide you with some insight into a couple of issues. One is that the budget process is a fairly involved process that takes place between now and all the way into the end of this fiscal year before the ramifications of what happens in the governor's office, the House, and the Senate fully have implications on us as we do our day-to-day work here at Augusta University. So, and I want to give you just an idea about this so you can have a pretty good feeling for what the process is and why it takes so much time and why we want to make sure that we try to manage expectations based off what you may have seen in the newspaper. First, over number one, Governor Kemp recommends what the budget will be for the fiscal year, and he recommends that, and that budget makes its way to the House of Representatives. It is actually the House of Representatives who officially passes a bill which contains the budget, but the House relies heavily on recommendations from Governor Kemp. Now, although you may have seen in the news that the governor has recommended, as I said, some great things for us here, the House has the opportunity to add to or take away from that particular budget, and that's the first process that takes place. So the governor recommends the budget, it goes to the House of Representatives. And number two, once it passes the House, it goes over to the Senate. Now, the Senate has the option to either accept the budget as it is presented from the House, but more than likely, they make their own additions or subtractions to the budget, put their own stamp on what the budget is going to be for the fiscal year. And if there are disagreements between the budget that the House passes and the budget that the Senate passes, we go to step three, in which that budget is then, with the differences, is submitted to a conference committee, which has representatives from both the House and the Senate. And the conference committee reconciles any potential differences between those two budgets, between the House budget and the Senate budget. That takes us to step four. When that reconciliation comes out, it goes back to the House and the Senate in step five. They then pass their budget, the formal budget, as a bill on number five. From there, it goes to step six to the governor's desk, and then the governor has 40 days to sign the budget or to veto any parts of legislation in the budget that comes forward in step six. Once the governor signs the budget, that allocation, that money that has been budgeted for the University System of Georgia makes its way to the USG in step seven. And then usually at the May Board of Regents meeting, usually it's in May, the Board of Regents will then determine what the allocations are to the individual campuses, including Augusta University, based off that allocation that comes out from the budget which the governor has signed. So as you can see, it's a fairly drawn out process. It's a fairly specific process, and it is a process that it really has already begun. But takes as long as May before we may know if the budget is, in fact, final what that budget might look like, which begins on July 1st. Now, Georgia really has two budgets. And I think it's sometimes confusing as to what we mean by that. The fiscal year 2023 budget, which we sometimes refer to as the big budget, provides funding for all state agencies, including the University System of Georgia, through them to Augusta University, provides funding that will begin July 1st, 2022, and extends through the end of the fiscal year, which is June 30th, 2023. As I mentioned, this is the budget that is passed during the legislative session that's currently underway, which began on the second week of January and extends for 40 days. Now, that's 40 days in which they're in session. That whole process usually extends from the second week in January into late March or early April. And that's when the House and the Senate and the reconciled budget is passed and goes to the governor's desk for signature. But there's also something called the amended budget. And the amended budget adjusts the current year budget, in this case, fiscal year 2022, to reflect any shortfalls in funding, provide additional funding, or may restore previous cuts that were passed in the previous year. This passes usually the first month or so of the session. So there are two types of budget proceedings that are currently undergoing right now. Right now, the General Assembly is debating and will debate on the amended budget, and they'll also begin to start work on passing the full budget that will take place July 1st. This is important to keep in mind, the two budgets as well as the process, as we start talking about what came out of the governor's recommendation. Governor Kemp gave the state address on January 13th, just this past January 13th, and it was at that time that he submitted his budget recommendation to the House, and it had a number of really, really exciting things that will impact the state employees of the state, but also Augusta University specifically. And essentially, the governor's recommendation had several things that directly impact us. First, the governor recommended a $5,000 pay increase for all full-time state employees. And he did this in both the amended recommendation and in the full budget recommendation. In the amended budget recommendation, he recommended a one-time addition into that budget, which would give state employees that $5,000 bonus in the current fiscal year we're currently in. And then also in his big budget recommendation, recommended a permanent increase beginning in fiscal year 2023. This is really good news for all of our state employees who would see this $5,000 in their paycheck. And we can't thank Governor Kemp enough for putting that forward. In addition to that, he also, in his budget recommendation, recommended an increase to the university system budget that will allow us to eliminate the special institution fee that we now charge all students per semester. This is also an incredible opportunity for us to do two things. One, it will allow us to reduce the overall cost of higher education to our students. We're passing that cost reduction on to our students. And we're really, really excited to be able to do this. But the second thing it allows us to do is the additional money coming into the system office would then pass down to the individual campuses and allow us to make up for the loss that we'd see in the elimination of that special fee. So we're excited about that, and we'll wait to see if that is in fact becomes law. The governor also recommended a little over $8 million for design and constructions for our central energy plant. This is our heating and cooling plant on the Health Sciences campus. It's a major renovation project for us and allow us to take care of some basic utility and facility aspects on campus. And it also provided a recommendation for a third year of increased funding for medical education that will help us directly support the Medical College of Georgia. And this is a long-term process we've been talking to the General Assembly about. We've had funding increases in the last 2 years. We hope that we'll get the final third year funding this time around. Now, a couple things to remember. First, we want to thank Governor Kemp. Thank him for a tremendous opportunity for Augusta University, for our health system, and indeed for the entire higher education system in the state of Georgia, for all state employees. But I want to remind everybody this, at this point in time, is still just a recommendation. Don't forget the overall budget process that I just described, because even though the governor has recommended that $5,000 increase, it must be passed in the amended budget and then it must be passed in the full budget. And you saw the process there. So we're optimistic. We're very enthusiastic and we're very, very grateful to the governor for this. And stay tuned. We'll provide you with all the information as it becomes available. And I hope that that provides some answers to you on what I know has been a lot of questions from folks regarding that particular increase in pay. Now, we're not completely out of the COVID-19 woods yet. If you've been looking at the news, you certainly know that. You probably are all very familiar with the Omicron variant. I want to spend a little bit of time talking about, and I want to get to some specific questions that some of you have raised regarding COVID-19 and our protocols. But first, I do want to take this opportunity to thank all of our frontline healthcare providers. You have worked tirelessly day in and day out for several years now regarding COVID-19. You're still working day in and day out, 24 hours a day. You're still on the front line, and we can't thank you enough for all the great work that you do. Now, this shows some data on where we currently are with regards to COVID-19 on the AU campus. The graphic on the right shows you, as of yesterday, the number of COVID patients that we currently have in our health system, those that are in the ICU and those that are on ventilators. And you said we had 115 COVID patients, or we had 115 patients in the hospital who had COVID, I should say, as of yesterday, but only 24 of those were in the ICU and only 14 were on ventilators. The graphic also shows you the number of individuals who are vaccinated versus unvaccinated that are testing positive for COVID-19. And this is one thing I'll talk about in a few minutes. We're seeing some breakthrough cases. That is, individuals who have been fully vaccinated and boosted are now showing up in some cases that are positive for COVID-19. We want to acknowledge that and make sure we all understand what that means. The two graphics on the left, you probably have seen before at previous town halls I've given, and shows you on the top, the green individual data points there show you the positivity rate. That is the percent of patients that we're testing COVID-19 that are positive. The black line shows you the 7-day rolling average. And as you can see, our positivity rate is quite high. It's about 40% now, based off the patients that we're testing in our health system. Now, the sheer number of patients that we're testing is somewhat lower now because of most of the testing that we're doing is now being done by the local Georgia Department of Health operation, and we're certainly grateful for their support. But that shows you the positivity rate. And then the graphic on the bottom reflects the number of COVID-19 patients we currently have in our health system. It shows you the various waves of COVID we've had. Going back to March of 2020, and it shows you the rapid rise that we've seen, the most recent rapid rise we've seen in COVID-19 patients. Now, there's some miscellaneous aspects about COVID-19 I just want to mention to you. Most of you are already familiar with this, but let me just sort of level set where we are with COVID-19. We know that the Omicron variant is the predominant variant in Georgia. In fact, it's the predominant variant worldwide, and greater than 97, 98% of the patients that we're seeing in Georgia that are COVID-19 positive are positive for the Omicron variant. We know a couple things about this variant. We know it is much more contagious than the Delta variant and is even more contagious than the original variant of COVID-19 we saw back in March and spring of 2020. It's more contagious, but it is much less virulent than the Delta variant. By that I mean that those individuals who have COVID-19, who have the Omicron variant, show milder symptoms, especially those that are vaccinated, and the cases don't seem to be nearly as severe as we've seen with other variants. Now, although the Omicron variant is associated with breakthrough cases, more so than we've seen in other variants, vaccination along with boosting is still the best form of protection. And I cannot emphasize that enough. We still want everybody to get vaccinated. We strongly encourage everyone to get vaccinated. We strongly encourage those that are vaccinated to get a booster. That is the strongest protection you can have from COVID-19. And what we're seeing in those individuals that do have breakthrough cases, they're much less severe than those that are unvaccinated. So please, if you haven't already been vaccinated, do so. If you haven't already been boosted, please do so. Now, because the Omicron variant is less severe than Delta, and because there's been a whole lot more availability of home testing, the number of COVID-19 cases that we're seeing and that you see reported is, in fact, probably underreported. There are probably more COVID-19 cases out there than we're reporting. And this is due, again, to the less severity. So there are a lot of individuals who may have had the Omicron variant and never knew it, or they had just a slight common cold type symptoms and they didn't get tested, or they're using at-home tests to determine if they're COVID-19 positive, but not coming into our health system to get tested. And so therefore, the information that we're presenting, we feel pretty sure is underreporting. We're continuing to report the number of students and employees at Augusta University who are testing positive for COVID-19. I'm continuing to do the Monday morning videos. I did one just yesterday. If it's not already on the website, will be on the website very soon today, to try to give you an idea of where we are with COVID cases. And then we're going to try to continue to provide that narrative to keep you informed as best we can. I've done well over 50 of these videos over the past year or two. We will continue to do whatever we can to get you the information that you need. Now, the good news is it is projected that the current wave, the current Omicron wave that we're seeing, will disappear as rapidly as it has appeared. We had been anticipating a dramatic increase in cases. That's what we're seeing. We're seeing that worldwide, but we're also anticipating an equally as rapid decline in cases in the very, very near future. And this data shows you the number of cases in the state of Georgia that's reported to the Department of Health. You can see that yellow line, which is the rolling 7-day rolling average of COVID-19 cases in the state of Georgia. On the far right, it is peaked and it's beginning to come down. And that is certainly very, very good news. Now, typically, what we have seen in the health system here on the AU campus is that our trends tend to lag behind what we see in the state and in many counties in the state by about a week to 10 days. So we have just begun to plateau. We hope we're in a plateau now. And if this variant holds true with all the other variants, we should start seeing within the next week to 10 days a fairly dramatic decline in cases. This shows you the 7-day rolling average for the last two peaks we've had for Georgia on the far left, and then for Fulton County, Richmond County, and Columbia County. And I thought it was interesting to look at this. Depends on where you are, but as I've shown you, the cases in Georgia are already beginning to decline. Fulton County, which was one of the first counties in the state to really begin to report cases, especially with the Omicron variant, has already been on a decline for some time now. Richmond County appears to be declining, and Columbia County appears to be plateauing and will probably start declining as well. And so we're optimistic that the dramatic increase you're seeing in cases should begin to decline very soon. And if you want to go worldwide, this shows you the number of cases in various countries. As you probably know, the Omicron variant was first detected in South Africa, and that's where it first started. And as you can see, the cases in South Africa have already begun to decline rather precipitously. France has not yet begun to decline, as the United States on the bottom, but the UK is beginning to see cases decline. So we're optimistic that we will follow in the United States, and Georgia and in Augusta will follow the trends that we've seen across the country and indeed across the world. So stay tuned. We're optimistic. We're hopeful that we'll start seeing a decline in these cases as well. Now, let me try to answer some of the questions that we've seen come along regarding COVID-19. We get asked a lot, are masks required outside of private offices, and is social distancing required in gatherings and meetings? And I think it's important to know, as we've said all along, that because we have a health system as part of our campus, and because we have medicine and dentistry, as well as nursing and allied health as part of our very DNA, we do have clinical spaces on campus, and they sometimes have different criteria requirements for mask wearing, social distancing, and even vaccinations. Masks are currently required in all clinical spaces. So if you go over to the health system in the hospital, you're required to wear a mask there. If you go to the clinic and the Dental College of Georgia, you're required to wear a mask. In some of the other clinical spaces, you're required. But for all other campus spaces, as it is currently, masks are strongly encouraged but not required. And social distancing is also encouraged in all gatherings, especially those indoors, but again, is not required. So if you're in a clinical space, you're probably going to be required to wear a mask. If you're on campus in any other space, we strongly encourage it, whether you're vaccinated or not, but it's not required. Now, the CDC just noted in the news that they're looking at recommending N95 or KN95 masks instead of the cloth mask. And someone asked what our experts say. And first, let me tell you that I can't tell you how proud I am the fact that we have experts right on our campus as part of the health system that can help us answer these questions. And our experts tell us that yes, N95 and KN95s are in fact more protective, but the cloth mask, although they're more porous, offer much better protection than no mask at all. So please wear a mask, especially if you're in crowded situations. If you can get N95 or KN95s, they would potentially provide more protection, but a cloth mask is certainly better than no protection at all. All right, what days exactly are the COVID tests being conducted by the Department of Health at the 15th Street drive-through location, and how can I get tested? Testing through the Department of Health is available 9 a.m. to 3 p.m. Monday through Saturday at the Annex testing site on 15th Street. This is where we had started our drive-through testing some time ago. You can reserve a space online, or employees can call. If I can see that number here, 706-721-3418, and hit option 1 to reserve or to get testing at the Annex. Both student health and employee health offer testing by appointment only as supplies last. And we ask you to find more information at augusta.edu/reopening for that information. Will we be given 8 hours of paid leave to use after receiving a COVID-19 booster for possible side effects as well as we did in 2022? Currently, the University System of Georgia has not yet announced whether additional leave time for vaccinations will be offered, but we still encourage you to get vaccinated as soon as possible and discuss any potential accommodations with your supervisor. And lastly, we've gotten a lot of questions about protocols. What do I do if I have symptoms? How long do I need to isolate or quarantine? When can I come back to work? What do I do if I've been exposed to someone who has tested positive? And the best way to answer that question is to refer you to our website at augusta.edu slash COVID-resources/guidelines. And we have protocols for any potential scenario that you might have. I've got a couple of examples shown here, and again, the website. This is the best source of information to you. The protocols have changed within the last several weeks, right after Christmas, and they may very well change again. So to get the most up-to-date information, please, again, go to the website, www.augusta.edu/COVID-resources/guidelines for the most up-to-date information for the protocols. And if you still have questions, don't hesitate to ask your supervisor or call HR or student health and get the information that you need. Well, I want to thank you very much for joining me today on this town hall. We have promised to keep you informed as best we possibly can through all sorts of venues. This is just one venue in which we hope to be able to keep you informed. The Monday and Tuesday morning videos that I do once a week, we provide most up-to-date information there. And please continue to check the website, Augusta University website for COVID resources there for all information that you may need. We will get through this, and I do believe that the end is in sight. So please stay safe, stay strong, and go Jags.